welcome back to Autism, A New Perspective, the podcast show where we help you understand what is going on in the mind of your child. And we always encourage you that growth for your child is possible. I'm Kat Lee, and in this week's podcast, I visited with Dr. Sheely as we talked about parenting today and finding time to guide. Let's listen in. One thing I talk to parents about, Dr. Sheely, and honestly other professionals, and not just in RDI, is that children are getting this diagnosis early, 2 years old, 3 years old, 4 years old, and then really being recommended that they go to clinics where they're spending 40 hours a day or 8 to 5 or 9 to 6 or whatever. And then once they're to school age, then they're going to school. And I think it's so important for us to talk about the foundation of RDI, which is parents having the guiding relationship and how other professionals can help, but that their relationship is important. And I was thinking this morning when I was getting ready to talk to you, I was like, we talk about how important the relationship for the child, but it's also important for the parents to have that meaningful guiding relationship with the child. Let's talk about the value that has for a parent. It's just, for me, it's talking about their heart, that they can guide their child. What do you think?
Catherine, I do agree with you. And I'm not sure how, as a society, we got into this mold of procurement of services. And I'm not just talking about children with autism or ADHD. I'm talking about children who are young children who are at 7 o'clock before they go to school, going to the swim meet, and then after school, tennis lessons, and after tennis lessons, something else. And the children are exhausted. Oh, plus 3 hours of homework. So this isn't even, I'm not even talking right now about children with autism. But I see the problem being across the board, not just in the field of autism. For our children, the inability to have a guiding relationship where the child is developmentally hanging on what's going on with the parent, joint attention, thinking about things, getting excited, emotion sharing, for our children is a disaster. And there's no way to sugarcoat it. If children don't have this relationship with the parent, the relationship they're going to end up having is with the static information, not even the information with the person who's teaching it to them. Because run correctly, not correctly in my mind, but run correctly, it's say it and say it quickly. So the children have a relationship with information, but they don't have that relationship with the therapist, nor do they have it with their parent. And sometimes parents get confused by this and think, oh, he hugs me all the time. We're not saying the child doesn't love the parent. We're saying that the child cannot access the guidance that he needs from the parent. And the reason he can't is because of the autism, not because the parents don't know what to do, but because the child can't access it.
I'm so glad you talked about that it's not that the child doesn't love the parent, because I do know that parents can sometimes feel that way. So I really appreciate you for saying that. But I also think one thing you and Dr. Gutstein train into us as consultants is there needs to be a time to guide. So time becomes such a valuable resource in order to be able to guide. And I think when our children are out in all these different therapies and activities, that time to guide, there's just not a lot of time. And that's why we spend so much time being trained to help parents find time, Dr. Shealy?
I think it's one of the most important things we do. And it's not often taken that seriously because it's like, let's just take a look at your schedule and figure how we're going to squeeze it in. That's not what we're looking for. We're looking for a time when the parent feels qualified. They feel qualified. I can do this. Where the child feels rested and they come together, and whether they're doing the meal for dinner or dusting the furniture or just sitting together and doing some little co-regulatory issues of interactions, the time is important. And we used to have this saying, oh God, years ago, and they'd say, it's not the quantity of time, it's the quality of time. But the truth is, it is also the quantity of time. You have to be there. If you want to get to know somebody, you want that person to trust you, particularly a child who's so vulnerable. You want trust from that child. You have to intimately begin to innately understand why the child does what he does and why you do what you do. What are your points of exasperation? And so that trusting, having the time to do it and not being rushed. Okay, I've got 15 minutes. Let's do dusting the furniture. Hurry up, we need to dust the furniture. Let's do it this way. Let's do it together. And you've got a disaster on your hands. I'm thinking, I keep trying to do these things and they don't work. I wonder why. Well, it is the quantity of time as well. I mean, have you run into that as well, Catherine?
Well, yes, and I always think about another slogan that we've had, which is slow down to go faster. And you can't slow down if you don't have time. I mean, time is such a valuable resource. And I don't think I'm telling anybody anything they don't know, that as a valuable resource, there's also a limited amount of it. And so, for that reason, I think we have to protect it and we have to honor it in some kind of way where we say, what I love what you just said, if you're going to have a relationship with anyone, you have to have time in order to for them to know you and for you to know them. That's anyone, much less your child. And so I do understand though that when parents receive this information about their 2, 3, 4-year-old from a doctor, there's a instinct to try to save them. And if the way they're being told to save them by very well-meaning people is to put them here, have them do this with the child, I don't want to take away from that feeling that the parents will have. I think what we're saying is, but you also, they need that relationship with you. They need to have that time with you, and that cannot be replaced by someone else.
Catherine, I recently came across an unpublished article, and the article was looking at this kind of this intense protocol we put our children through, and they were comparing it to RDI. And what they found is that the children who were in this intense experience were doing some very interesting things. They were actually they were using joint attention. They were acquiring words. But the difference was after that stopped and after RDI stopped, the kids who had done RDI were still doing it. And the kids who had had this intense experience and who were doing it not because of the relationship, but because the protocol said, you say this is what will happen if if you show joint attention, which was being taught, not part of developmentally where someone was. And I was so touched to see that because the parents had been doing the work, I'm sure they were continuing to do what they were doing. And the children continued to grow with the joint attention, not only just acquisition of language, but conversational language. because of that emphasis we put on communication. So all of this brings me back again to this issue of trust, which I've been thinking about for a while. Because just like we say, we know our children love us. And it's very hard to say, you mean my child might not trust me? Think how big that is. But when we talk about trust, we're talking about the ability to actually look at where the child is and what's the next step for that child. Something that will challenge the child, but not overwhelm him. And that's what RDI does. It teaches the parents to ask the question, what's the next step? You know, and that we're talking about that zone of proximal development where it's like, this is the next step. Oh, that's different, but I know what to do. And that's the kind of trust we're talking about. That's why our consultants are so valuable, because they're constantly looking, analyzing, and creating hypotheses. I bet if we do this, we'll see this.
And that is the hope of RDI. And I love, love, love what you say, which is it's not pie in the sky hope. And thanks for joining us for Autism, A New Perspective, the podcast show where we help you understand what is going on in the mind of your child. And we encourage you that growth for your child is possible. I'm Kat Lee. See you next time.